name is Mary Perry. I'm the Clinical Trials Director for the Inflammation Research Foundation. And today I'm sitting with Dr. Barry Sears, President and Founder of the Inflammation Research Foundation. Dr. Sears, thanks so much for joining me today.
Always a pleasure, Mary.
So Dr. Sears, today you're going to give a lecture talking about the role of hormone replacement therapy and healthy aging. And before we begin, do you mind just giving a little overview of what you're going to discuss today?
Well, oftentimes we think of anti-aging as if I only replace back the hormones of youth, testosterone, estrogen. And that was the basis for many decades of the anti-aging industry. But now we realize that these hormones, like all hormones, are multitasking hormones. The reason why they're associated as their levels drop with aging is because they are also anti-inflammatory hormones. And that's really the secret to slow down the aging process, is to reduce inflammation. And that'll be the subject of my talk that I gave about a month ago to a group of Mexican physicians.
Excellent. I look forward to this, Dr. Sears. All right, I'll let you share your slides now.
The title of this lecture is Optimizing the Resolution Response to Enhance Hormonal Replacement Therapy. Before we start the lecture, sometimes it's very useful to have definitions. Often when we think of the word or the term anti-aging, we think of reversing the aging process. And to do so, if we only add back the hormones that were higher in our youth, we would turn back the hands of time. Well, first of all, the term anti-aging is oftentimes an oxymoron. Aging is a natural process, and therefore anti-aging is an unnatural process. A better definition of what we should be talking about is healthy aging. It's increasing the length of your health span. Health span is defined as the length of time you are generally in good health and free of disabling chronic disease. And to have healthy aging, you have to improve the balance of inflammation and its resolution. The primary hormones used in hormone replacement therapy have always been estrogen for females and testosterone for males. However, all hormones, including these hormones, are multitasking hormones. They have other roles to play. Yes, both estrogen and testosterone are reproductive hormones, but little known, they're also anti-inflammatory hormones. And this now begins to explain some observations, because we know that as we have decreasing levels of estrogen and testosterone in our bodies, we seem to develop a great number of chronic diseases, metabolic disorders such as obesity and diabetes, heart disease, loss of bone and muscle leading to frailty, immune disorders, neurological disorders. But all of these are related to inflammation. And there's two types of inflammation as we age. One is called inflammaging. This is the buildup of inflammation as we become older. A second type of age-related chronic diseases are mediated through what is called immunosenescence. It means simply that your immune system is aging with a decreased efficiency caused by increased inflammation. Inflammation and immunosenescence are really two sides of the same coin, increasing levels of inflammation. Many years ago, Time magazine ran this as their cover story, talking about the secret killer, the surprising link between inflammation, heart attacks, cancer, Alzheimer's, and other diseases. Well, they were partially correct. It wasn't inflammation per se that was the linkage. It was our inability to control inflammation that's the linkage between our age and all these chronic diseases we associate with the aging process. But again, we also have to think that you need a zone. It's not that inflammation is bad, because if we had too little of an inflammatory response, we'd be sitting targets for microbes. Our injuries would never heal. But if the inflammatory response is too strong, then inflammation is not resolved. And as a consequence, the body begins to attack itself, creating chronic disease states. So let's try to make this relation a little simpler. Think of inflammation as causing damage. Think of resolution as causing healing. We need some inflammation, but we have to turn it off and heal the damage caused by it. So now we can begin to define aging as a breakdown of systems biology. You're probably wondering what systems biology is. Today we talk about molecular biology, looking with a microscope into nuances of how biology works. But systems-based biology is much more complex and much more complicated. And here's a graph that can basically look at the differences of systems-based biology versus molecular biology. In terms of targets, in systems-based biology, you're looking at very complex, interrelated biological systems. In molecular biology, you're looking at single molecular targets. And here's some examples. The immune system, incredibly complex, it's an example of systems-based biology. And so is something that also controls the immune system, which we'll talk about in this lecture. This is the resolution response. Whereas molecular biology deals with enzymes or monoclonal antibodies, define targets, but not looking at the whole system. But the key difference between systems-based biology and molecular biology is your primary intervention to control them. In molecular biology, your primary intervention is drugs. In systems-based biology, your primary intervention is your diet. This is how the body should work. When we have an injury, and I'll describe later that it's be a wide number of injuries, the body immediately responds by creating inflammation. But that inflammation then turns on what I call the resolution response. This is really composed of three separate components. It's reducing inflammation by reducing hormones known as eicosanoids and other inflammatory mediators such as cytokines, resolving the inflammation through a separate hormonal group called resolvins, and then repairing the damage by activating the gene transcription factor AMPK. Only when all components of the resolution response are working in sync, like a relay team, will you get to your final destination, which is healing. Now, what are some of the types of injuries that can turn on inflammation? Well, one would be microbial invasions, like a viral infection, like causing COVID-19. Another might be external injuries. You're hit by a car. But you could also have internal injuries. Your diet can turn on inflammation. Dysfunction in your gut can also turn on inflammation, as can oxidative stress. Surgery will turn on inflammation, as will many drugs, especially cancer drugs, and stressors in our life, such as exercise, pollution, toxin exposure, and emotional stress. All of these can turn on the inflammatory response that's embedded deep in our genes. But the important is these are on-demand inflammation, or really on-demand events. Inflammation is only turned on by an injury. Otherwise, it's quiet. Likewise, the resolution is quiet because it is only turned on by inflammation. These two are linked together. And so to have healing requires injury-induced inflammation to be totally counterbalanced by the appropriate level of the resolution response. This is important because injuries occur at random. You can't predict when an injury will occur. But the resolution response has to be continually optimized to heal the injury completely. And here's the time course of inflammation and resolution. Something happens at the initiation phase to turn on inflammation. That's where we get the classic sign of edema, swelling. then followed by pain as we have infiltration of immune cells, such as neutrophils and macrophages, into the injury site. These cause pain, they cause destruction, they cause damage. But then we basically now switch to resolution, where basically now these inflammatory cells from the immune system are taken out of the injury site, and we heal the injury and we come back to homeostasis. Let me give you an example. Let's say you cut your hand with a knife. If your resolution response is working correctly, within a few days, the hand is healed completely. It's as if you turn back the hands of time. That initially, when you cut your hand, you had inflammation, pain, swelling, edema. These are the classic signs of inflammation. But the resolution response basically erases that, turning the hand to the same level of function it had before you cut it. So this is what the resolution response actually is. It's a great example of systems-based biology. Healing requires an on-demand resolution response to control the inflammation caused by any injury. But that healing requires an orchestrated series of hormonal and genetic implications to basically for success. But the key thing is each step of the resolution response can be blocked by poor dietary choices. The molecular players in the resolution response are complex but nuanced. There are certain gene transcription factors that either turn on inflammation or turn it off. Those that turn on inflammation, the key one is called nuclear factor kappa B. The key one that turns off inflammation and repairs the tissue damage is called AMPK. We also have hormones which are diametrically opposed. Eicosanoids are the hormones that are the first responders of inflammation. Yet what turns off inflammation is another group of hormones called resolvins. You can see from this illustration the complexity of the system. All four components have to be working in time, in sync, to maintain balance. If we maintain balance, we maintain wellness. But if one of these four systems is not functioning at its peak efficiency, the gyroscope falls over, and we now accelerate chronic disease and the aging process. And this is what happens when we get unresolved inflammation. Somehow the resolution response in its complexity is blocked. We have an injury, it causes inflammation, but that inflammation is no longer resolved and leads now to developing chronic unresolved inflammation. It's chronic because it's there. It's unresolved because basically it is below the perception of pain. It's causing tissue damage, but by being below the perception of pain, you can't feel it. And since you can't feel it, you do nothing to stop it. But this inflammation doesn't evaporate like the mist off the Irish moor. It can be now turned into new permanent sources of inflammation. Either one, called fibrosis, which results in scar tissue formation, or even more insidious, is cellular senescence. When cells are transformed, like a cancer cell, but into a cell that doesn't die, but continues to spew out more and more inflammatory mediators. Both of these lead to the acceleration of chronic disease and the acceleration of the aging process. Now, our goal is really to optimize this resolution response. And this really requires what I call the 3 R's. The first R is reducing diet-induced inflammation. As I said earlier, one of the primary causes of inflammation is actually your diet. The second phase requires resolving the residual unresolved inflammation. And the final phase is the repairing of the tissue damage caused by the unresolved inflammation. Each one is sequential in time. Each one cannot start before the previous phase has been completed. Now, what are the dietary activators of the resolution response? There are three. One is the zone diet, not a diet to lose weight, but a diet to reduce inflammation. Another activator are omega-3 fatty acids. And the final dietary activator are the polyphenols. And now let me explain how each one works. As I said, the zone diet was developed to reduce diet-induced inflammation, just like a drug. And what are some of these sources of diet-induced inflammation? It could be excessive oxidative stress, formation of free radicals. This is a result of excess calorie intake. If you're overweight or obese, you have excess oxidative stress and you're already inflamed. Another source can be excess eicosanoid formation coming from the combination of excess omega-6 fatty acids and insulin resistance. This is a deadly combination because this increases the building blocks of the levels of the hormones of eicosanoids that drive inflammation. And the final aspect is the excess activation of really sensors on all of our cells. They're called TRL or RAGE. And they're always searching for either bacterial fragments or damaged fragments to alert the cell something is wrong and take action to basically protect yourself. So the zone diet as an anti-inflammatory diet is highly defined. First of all, it has to be a calorie-restricted diet. The excess calories is one of the primary reasons that causes inflammation to accumulate in our body. But it also has to be adequate in protein. Not too low, but not too high. It has to be moderate in low glycemic carbohydrates to decrease insulin resistance. What are low glycemic carbohydrates? These are things like fruits and vegetables. It also has to be low in fat, because fat is very rich in calories, and anything that increases calories will increase inflammation. And finally, it has to be rich in fermentable fiber and polyphenols. So the description of the zone diet is actually quite precise, but only when you are following all of these components will it become an anti-inflammatory diet. Now, I said insulin resistance is maybe the most common manifestation of diet-induced inflammation, because insulin, besides being the hormone that makes us fat, is also the hormone that controls much of our metabolism. So to think about insulin resistance, perhaps think of this image of a champagne fountain. At a wedding, the champagne fountains are beautiful. You start filling up the first glass, it overflows into the next tier, into the next tier, into the next tier. It's a wonderful celebration. But we can use that same graphic example to demonstrate how insulin resistance works. As you build up unresolved inflammation, you start to develop insulin resistance. This leads to diabetes. Once you have diabetes, you're 4 times more likely to get heart disease and twice as likely to get Alzheimer's. So if you don't want to get diabetes, heart disease, or Alzheimer's, what's your number one drug? Reducing insulin resistance. It's not really a drug, it's really it's a diet, an anti-inflammatory diet that causes the reduction of insulin resistance and therefore decreases the likely spillover of that chronic disease champagne fountain into diabetes, heart disease, and Alzheimer's. But that's only the first phase of your journey toward healing. The second phase starts with having adequate levels, and this usually means for most people, high dose omega-3 fatty acids, because these are critical for resolving cellular inflammation. We think of inflammation often using the image of a burning fire that rages with intensity and then dies out to embers. It's a wonderful image. Unfortunately, it's not true, because inflammation and resolution are 2 separate pathways. And to basically get those pathways in balance, we have to balance the precursors, the hormones, that control inflammation and resolution. One group of hormones are called eicosanoids, and they're derived from omega-6 fatty acids, and in particular, arachidonic acid or AA. These are the hormones that cause pain. These are the hormones that cause damage. But the other set of hormones, these are derived from the omega-3 fatty acids, in particular, eicosapentaenoic acid or EPA. These are the ones that turn off inflammation. You have to turn on inflammation, but you have to turn it off. As long as these two fatty acids are balanced in your blood, you have the ability to do exactly that. So what are the benefits of maintaining a low ratio of arachidonic acid to EPA in your blood? One, you reduce the intensity of the initiation of inflammation. And at the same time, you accelerate the resolution of inflammation. This is a great deal. But this ratio is controlled 100% by your diet. The first use of high-dose omega-3 fatty acids to lower cytokine levels was reported more than 30 years ago in the New England Journal of Medicine by investigators from Harvard Medical School. Now, we hear a lot about cytokines today because we hear about cytokine storms. All the complications of COVID-19 come from increased cytokine storms. But yet, basically, cytokines were being investigated at Harvard Medical School by these investigators more than 30 years ago. And they posed the question, could you reduce their levels by increasing the levels of omega-3 fatty acids? Well, what they did, they took normal individuals. They were healthy, but maybe they weren't quite as healthy as we thought. Because their ratio 30 years ago of the ratio of arachidonic acid to EPA was actually quite high. But giving them 5 grams a day of omega-3 fatty acids for 10 weeks brought the ratio down by nearly 90%. But as soon as they stopped taking the omega-3 fatty acids, the ratio of the arachidonic acid to EPA, a marker of inflammation, increased back to its original levels. Now, why is this important? Because they could see changes in the levels of cytokines that change with the ratio of arachidonic acid to EPA. As that ratio of arachidonic acid to EPA decreased, so did the levels of cytokines. As the ratio regained its normal earlier format, the cytokine levels returned to normal also. We had the same similar observations in elderly obese patients. These are the people most likely to develop complications of COVID-19. In this particular study, you can see that those getting the omega-3 fatty acids, their ratio of arachidonic acid to EPA dropped dramatically by 4 weeks and stabilized by 8 weeks. But in these groups, you can see that those who basically were taking the omega-3 fatty acids, the 3 primary cytokines, IL-6, IL-1, and tumor necrosis factor, all decreased significantly in the fourth week, and even more so by week 8. Now, why is this important? Well, cytokines basically cause inflammation and damage. But tumor necrosis factor is the cytokine that causes insulin resistance. So exactly how do these omega-3 fatty acids resolve inflammation? They do so because they are the building blocks of hormones. Hormones called resolvins, a very complex group of hormones only recently discovered, but all derived from omega-3 fatty acids. But you have to have adequate levels in the blood to make adequate levels of resolvins to turn off inflammation. So exactly how much do you need? It depends. It depends how inflamed you are. Well, let's say you're reasonably well. You want to maintain your wellness. You have no chronic disease. You look good in a swimsuit. How much will you need to reduce the ratio of arachidonic acid to EPA to maintain your wellness? The answer is about 2.5 grams of omega-3 fatty acids per day. Today, the average American consumes 125 milligrams of omega-3 fatty acids, nearly 95% deficiency. But what if you're no longer well? What if you're inflamed? You're obese. you have diabetes or heart disease. The levels you need are higher. And what if your pain is no longer below the perception of pain? It's chronic pain, like rheumatoid arthritis or pain coming from cancer treatment. The levels are still higher. And what if you have neurological diseases related to inflammation, like depression or attention deficit hyperactivity disorder, or Parkinson's, Alzheimer's, multiple sclerosis? The levels needed to get the right ratio of arachidonic acid to EPA is correspondingly higher. Make no mistake about it, these are high levels, but these are the levels one requires on a daily basis to maintain a balance of arachidonic acid to EPA to allow the body to turn off inflammation. But this is not a guessing game. It's really a testing game. Your goal, and your blood will tell you if you're taking enough. Your goal is saying, I like to have the ratio between 1.5 to 3. If it is, I've done everything in my power from a dietary standpoint to basically help move the resolution response along. As the ratio gets higher, your levels of inflammation become higher and higher in every cell in your body. Today, the average American has a ratio of about 20. You can see from this graph, that's in the poor zone, red zone. Red's bad, green is good. Less than 1% of Americans are in that green zone. However, you can get there. How? By appropriate supplementation. But the final step of the resolution response is the most complex and oftentimes the most difficult. It's the activation of the gene transcription factor, AMPK. AMPK can be considered the master switch for tissue repair because once you turn on AMPK, it takes over your entire metabolism. Everything you see red, AMPK inhibits. Everything you see in green, AMPK activates. And AMPK is under profound dietary control. And it's the last step of the resolution response. There's no magic nutrient to control AMPK because you first have to reduce inflammation, then resolve it, and then try to activate it. So let's make it simpler. If you can activate AMPK, it repairs damaged tissue. That sounds like the fountain of youth to me. As a consequence, you live longer. Now, the key factor, the key dietary factor that's important in activating AMPK are polyphenols. These are the chemicals that give fruits and vegetables their color. So about several years ago, about 7 years ago to be particular, they went to, did studies in the old Italians living in the upper mountainous regions of Tuscany, who still followed the old diet, saying, perhaps we measure how many polyphenols they consume, it'll have some impact on mortality. This is shown in graph B. As you can see, the amount of polyphenols they consumed had absolutely no impact on the rate at which they died. This made no sense to the investigators. Then they realized, saying, maybe the polyphenols have to get into the blood to have an effect. They're very hard to measure in the blood, but they leave the blood by urination. So by collecting urine samples, they could see how much polyphenols actually enter the blood by the levels of polyphenols in the urine. And now this is shown in graph A. Now they found exactly what they were looking for. Those who had the highest levels of polyphenols in their blood had a 31% reduction in death, the ultimate marker of health. No drug known to mankind can do this. But if you consume enough polyphenols, they can, but only if they get into the blood. This is a hard task because most polyphenols don't get in the blood. There are about 8,000 known polyphenols, but most of them are water insoluble. They end up in the gut. They're good for the gut, but very few of them get into the blood. But those that get in the blood are the ones that have the greatest impact. And these usually come from a subgroup of polyphenols known as anthocyanidins, and these are found primarily in berries, especially blueberries. And these can be purified to much higher concentrations to now have dramatic impacts on activating AMPK. Now, how does AMPK get activated? Indirectly, as most things in systems biology. Actually, the AMPK activates another energy sensing enzyme. These are called the SIRT enzymes that activates another upstream modifier of AMPK that turns it on, and then you start the cycle that keeps this whole signal going over and over again as long as you maintain adequate levels of polyphenols in the blood. And that you do only by the diet. So here are the dietary activators of AMPK. No one will be perfect, but the more you combine all three, the more you activate AMPK. We said the polyphenols are the most powerful, but the resolvins, those hormones coming from the omega-3 fatty acids, are also powerful. Not as much as the polyphenols, but they have an effect. And likewise, calorie restriction that you achieve by following the zone diet can activate AMPK. So the more of these three dietary factors you control, the more likely AMP will be continually activated. But there are also dietary inhibitors of AMPK. And there are two in particular: excess calorie intake and excess intake of glucose. So you're seeing that this AMPK is an ancient transcription factor under very, very profound dietary control. And how do you know if you're basically have optimized your resolution response? It's hard to look in the blood per se because these hormones and gene transcription factors do not enter the blood. They stay within the cells. But you can look for markers. Markers that tell you whether or not you're in that zone where basically in the zone where the resolution response is optimized. One marker is the ratio of triglyceride to HDL. This is a marker of insulin resistance. You want this to be low. Another marker is the ratio of arachidonic acid to EPA. This is a marker of unresolved cellular inflammation. You want this to be low. Finally, there's the marker called glycosylated hemoglobin, often used to diagnose diabetes, but it also can be used to see how active your AMPK is. And you want this to be low. Not low, abnormally low, but on the low side of normal. And what numbers are you looking for? For the triglyceride to HDL ratio, it should be less than 1. For the ratio of arachidonic acid to EPA, it should be between 1.5 and 3. And your A1C should be between 4.9 and 5.1%. These are difficult to achieve. They can be achieved, but they are difficult. Why are they important? Because the resolution response is totally dependent upon these factors being in their appropriate ranges. And when they are, that's when I describe you're in the zone. The zone is where basically the body's ability to turn on inflammation and turn it off and repair the damage is now balanced. Any one of the three factors that can get you to the zone is good in its own right, but only when they all work together. When each of them are basically doing their job effectively, are you in the zone? And in the zone, basically you've done your best opportunity to basically reprogram your immune system, your ultimate defense against pathological invasion. Now, I said earlier that we often think of hormone replacement therapy as replacing sex hormones. But the fact is they also have, as hormones, indirect effect on the resolution response, both estrogen and testosterone. But let me finally end this lecture talking about the newest threat we have to healthy aging. And this has been the rapid overnight appearance of COVID-19. The leading cause is the death in the United States in the year 2020 are the following: heart disease, cancer, and they've been around for a long time. But the number three cause of death is now COVID-19. This is remarkable how a virus that had not existed before has jumped from zero to number three cause of death in America. Now, the question is there a role of the resolution response in the treatment of COVID-19? And the answer is, I believe, it's very strong yes. Let's look at potential treatments for COVID-19. One treatment is quarantine. It is effective, but it destroys economies and destroys social fabrics. Another possibility is called reaching herd immunity. Let everybody become infected, and they'll have hopefully some immune response that can allow them to basically hold off of COVID-19 the next time it reinfects their body. Now, of course, there'll be some collateral damage called death, because some people, because of the complications of COVID-19, will die. What about vaccines? Some vaccines are remarkable. The vaccine for measles, great vaccine. The vaccine for smallpox, wonderful. Other vaccines are not so good. The vaccine for influenza, it comes and goes and really doesn't give much protection. But for the coronavirus, we have no vaccines. That's why you can get a cold year after year. They're caused by viruses, many of them coronaviruses, but they don't give long-lasting immunity. And what about antiviral drugs? Perhaps they'll save the day. Well, it turns out the antiviral drugs are not nearly as effective as we're led to believe. So the things we have done in the past, quarantine, having everybody become infected, trying to get good vaccines or antiviral drugs, they are not very attractive. But there's a fifth choice: reaching the zone. Reaching the zone to optimize the resolution response, which in turn reprograms your immune system. And here's how the resolution response and the COVID-19 can be done at many, many levels. One, by basically activating or optimizing the resolution response, you're preventing the ability of the virus to get into the body in the first place by improving the mucous barriers and the tight epithelial junctions that line the passageways of the lung. Also, you can prevent viral replication, but this requires constant activation of AMPK. And one of the primary causes of long-term problems in survivors of COVID-19 is fibrosis. Fibrosis primarily in the lung. And that can also be reduced by activating the resolution response. But the primary cause of mortality in COVID-19 are these cytokine storms. And that's the power of the resolution response. It puts out a cytokine storm. And finally, to protect you in the future, you have to form antibodies. To do this, you need an active AMPK, for it's required for antigen-presenting cells to make good, effective antibodies. So there's many ways that optimizing the resolution response may be our most appropriate treatment today and far into the future to reduce the mortality of COVID-19. But it takes some time to reach the zone. If you're not in the zone right now, it will probably take you 3 to 6 months with the correct nutritional program to reach the zone. But it takes less than 2 weeks to leave the zone. What does this mean? If you want to take control of your future, to increase your health span, to increase your likelihood of combating COVID-19, you want to stay in the zone for as much of your life as possible. And here are some of the potential outcomes of coronavirus infection. Let's be frank, we will all be infected someday. But if you are infected and you're in the zone, your symptoms will be mild, if any. It's as if it's, a mild case of the flu. But if you're out of the zone, you can expect to have significant respiratory symptoms, potentially requiring hospitalization with acute respiratory distress syndrome, and potentially life support on a ventilator. These are very good reasons why you want to be in the zone, because the coronavirus is not disappearing. It's not going away. It'll be our constant companion year in and year out. So I end with a new vision for medicine. Our goal is not anti-aging. Our goal is healthy aging. That can only be achieved by optimization of the resolution response. But to do so requires dietary control of both the hormonal and genetic mechanisms necessary for healing. And if we have optimal healing of damaged tissue, it will require an integrated dietary approach, basically systems-based biology. So in summary, there is a role for hormone replacement therapy in anti-aging. Its primary goal is not to restore sexual prowess, but to reduce inflammation. Optimizing the resolution response will produce better outcomes for those patients taking hormonal replacement therapy, because now the resolution response is reducing inflammation, as is the hormonal replacement therapy. Optimizing the resolution response can furthermore reduce the levels of hormonal replacement therapy needed to reduce inflammation to achieve our real goal of healthy aging. Thank you very much.
Dr. Sears, thank you so much for that very enlightening presentation. You really presented what the benefits are of controlling inflammation through the diet and aging successfully. So one question I had for you at the start of your talk, you talked about the benefits of hormone replacement therapy from an anti-aging standpoint, and also the benefits of controlling inflammation from an anti-aging standpoint. For those individuals who look to hormone replacement therapy more for the symptoms that they have, whether it's hot flashes or their inability to sleep, would following the Pro Resolution program where you're minimizing inflammation in the diet, would it help with some of the symptoms that people see with the decline that happens when these hormones go down?
The answer is definitely yes. The point I was trying to make in the course of the lecture is that all the benefits we have attributed to, say, hormone replacement are really mediated through their ability to basically reduce inflammation.
Mm-hmm.
Are they the most powerful agents we have? Not by a long shot.
Mm-hmm.
The resolution response is much more powerful. So the key thing of hormone replacement therapy is start low and go slow. And so you want to start with the least amount that will treat a symptom. For many women going through menopause saying, I have hot flashes.
Mm-hmm.
Good. Get in the zone, and then we'll use the least amount of estrogen to control the hot flashes. We want to use that estrogen for the least amount of time. So that we want to say we can now use the hormones not as the primary treatment, but really as a backup to really the primary treatment, which is the optimization of the resolution response.
Okay, because you actually answered my second question, because I was going to say if you do a good job of minimizing inflammation in the diet, but you still need to kind of go on the hormone replacement therapy. It sounds like once you minimize the inflammation, it might just mean that you can go on a lower dose and with the goal of getting off of it as soon as possible.
Or never even, for many women, they say, if I'm in the zone, say, I may never have a problem.
Right.
Many women go through menopause without hot flashes.
Mm-hmm.
They say, well, what's your secret? Saying, I don't know. It turns out those who have less inflammation will have less hot flashes. Actually, you can induce the same type of symptoms in males by taking a very large amount of vitamin B3, niacin.
Mm-hmm.
You can get a hot flash very, very quickly.
Mm-hmm.
And you can eliminate that very easily by taking the niacin with an aspirin.
Oh, that makes sense.
Well, how's an aspirin work? It reduces inflammation.
Very interesting, Dr. Sears. Well, I always learn so much from your presentations. Thanks so much for that compelling talk. And I always look forward to the next time we get to do these.
Okay, thank you very much.
Thanks, Dr. Sears.
Bye-bye.